Good afternoon, everybody. It's Dr. Nick Coatsworth, and welcome to today's Top 3. Now, today's shout out goes to all families who have elderly family members who are resident in aged care facilities or retirement villages around Australia. And you've had to cope recently with restricted visits. We know that, and that is an incredibly hard thing to have to cope with. I know my own father, who passed away some 8 years ago now, was in a nursing home for the last 3 years of his life, and it's very important to be able to visit your relatives when they are in an aged care facility. In fact, we never stopped that. It was not government advice to restrict visits to aged care facilities, and as the Prime Minister said today, it is actually more important now that we have controlled the amount of COVID-19 in our community. It is so critically important that you take the opportunity to be able to visit your loved ones in aged care facilities. That is something you can do. What you must not do, if you're an aged care worker or a visitor to a residential aged care facility, is visit when you have any hint of a respiratory symptom or a cold. That is, a cough, and you're not sure if you might be brewing something. Don't make that visit. A scratchy throat, and you might be brewing something. Don't make that visit. You had a cold yesterday, but you feel all right today. Don't make that visit. But do make that visit when you're feeling completely well and you know that your loved one will want to see you. That's so important, and we know that it's having a really negative effect on our elderly, vulnerable population not being able to see their loved ones.
First question for today. What is the recovery rate for COVID-19 in Australia?
So let's go through some numbers. We've currently got 6,645 cases of COVID-19 to date that have been diagnosed in Australia and in Australians. 71 Australians have lost their lives to coronavirus, and 167 people have been hospitalised at the moment, and 47 of those are in intensive care units. Of the 6,645, 4,258 have been reported by our public health units to have recovered. And over the past 24 hours, only 26 new cases have been reported in Australia. As the Chief Medical Officer, Brendan Murphy, has said, only about 4 out of 5 people that have COVID-19 have shown only very mild symptoms in Australia. And it does appear that because we have been able to maintain access for Australians to healthcare and hospitals when they need it, that the death rate, although it is tragic, has been low in comparison to other nations. And that's because we have maintained access to care as and when people have needed it. We do have to look out for Australians who are at higher risk of COVID-19, people with compromised immune systems, especially people who are 65 and older with chronic medical conditions, and those who are 70 years and older. Aboriginal and Torres Strait Islander Australians who are 50 years and older with one or more chronic medical conditions are also at higher risk. And we made an announcement today we looked at this in the Australian Health Protection Principal Committee today, how we best protect Indigenous communities. So just to finish off that discussion, in the absence of the vaccine, our best weapon remains physical distancing. And as we start to chart our way out of COVID-19 into the coming weeks, we are still going to have to change our behaviours. There's still going to be a lot of hand washing. There's still going to be a lot of distancing from each other. And that sort of thing needs to continue even as some of the other restrictions are raised.
Second question for Dr. Nick. Can I still go to the dentist for a general checkup?
So from the Prime Minister's announcement today, we know that critical dental procedures are allowed to start again from next week, along with other elective surgeries. But following on from that last question where I said some things will need to stay in place, you should expect to see in your dental surgery, when you go, social distancing processes and procedures in place. You should expect to see hand sanitizer, just as you would if you went to any other healthcare facility. And if you don't see those things, then that is an issue and that your dentist would have to sort out. It's exactly the same thing as anything else that opens now. We need to see it open in a cautious and staged way where we don't sort of herd each other in, or the provider's not herding us in to sort of catch up on dental work or elective surgery. There'll be a temptation to do that, but we mustn't, because that will allow the virus to do what it does best, which is get from one non-immune person to another. Nonetheless, this is good news. It's good news for patients who need urgent root canal treatments, tooth extractions, or any treatment that might be referred to a dentist from a doctor. All routine dental examinations, though, and non-urgent treatments are still currently recommended to be deferred. Teeth whitening, insertions of fillings or crowns might be deferred as well. So you can still expect some of those things not to take place immediately.
Third question. If you are an essential worker, can you spend time with colleagues outside of work engaging in fun activities together?
So whilst we chart the road out from the COVID-19 epidemic, the restrictions that are in place, the Prime Minister's been very clear from last week's press conference that it was going to be another 4 weeks of the social distancing restrictions in place. So for now, we've got to stick with those. The thing that's being relaxed, or the restriction that's being eased, is our access to hospitals for elective surgery, for procedures that had been deferred. Getting those Australians who are suffering from not getting their surgery back into the theatre lists. But even then, we're doing it in a very slow and staged and careful way, because we don't want there to be an environment where COVID-19 can sort of explode again. So for the moment, for the physical distancing measures and interacting with colleagues, after hours, everyone, including essential workers, needs to avoid gathering in groups of greater than 2 to socialise with their co-workers or friends. You must only make essential visits. It's more important than ever, though, because this has been going on for quite some time, to maintain our mental well-being. And so a lot of people are getting in touch via Skype and video chat. And, I've said this before, but I've got to tell you, I've spoken to more old friends in the past 3 or 4 weeks and family than I have in a long time. And that might say something that I just need to talk to my mates more. But I think really a lot of Australians have use this as an opportunity to keep in touch and maintain what we call that social connection, even with physical distancing. We're going to need you to do it for a little bit longer.